Good day, Ms. Cahigal. I'm Marjorie DELA ROSA from BSN 1A, and in this video, I'll be performing the proper procedure on assessing the neck, thorax, and the lungs. So the first thing we need to do is the pre-assessment. This is where we are going to be gathering our equipments and making sure that they are functioning well. Then we introduce ourselves to the patient, explain what we are going to be doing, why is it necessary, and how can he or she cooperate. Then we wash our hands and observe other infection control protocols or procedures such as wearing the mask. Then we are going to be providing client privacy. Then we are going to be determining the client history on this specific assessment area, or in this assessment, the neck, thorax, and the lungs.
Come in.
Hi.
Hi.
So you are Miss DELA ROSA, right?
Yes.
Okay, so I am Marjorie DELA ROSA. I am a nurse in here, and today I'll be assessing your neck, your thorax, and the lungs, okay?
Okay.
Okay, so this is important because we don't want to see any abnormalities in those areas because you might have an illness that you may not know about, okay? So it is important to have it checked, okay?
Okay.
Okay, so a way that you can be cooperative in this is I will be sometimes asking you to raise your head or your chin up or put it down, okay? So I'll also be palpating some parts of your body so we can check it's if there are any lumps and bumps ba or masses, okay?
Okay.
Okay, so before we start anything, I'll just be washing my hands, okay? I'll be back. Okay, so I am back, okay? So before we start the assessment proper, I'm going to be asking you questions first about your history on those specific assessment areas that we're going to be assessing later, okay?
Okay.
Okay, so for this one, your neck, your thorax, and the lungs. So in that one, the main focus there is mainly your respiratory system, so the way you breathe. So do you have any difficulties in breathing?
No.
No? Okay. So, are there any times where you feel out of breath, like you do something very, parang little lang, very slow, tapos at the end, you're still, breathing, heavier, ganon? Like, for example, you're just gonna walk from this to a store. Are you gonna get tired agad? Like, there is a shortness of breath?
No.
No, okay. So, how about for example, you're running very fast. It's a very short distance lang. So, do you feel any shortness of breath? Parang you're trying to catch your breath at the end of where you run from?
No.
No. Okay, so that's good. That's good. It means you still have proper breathing even though you're doing a lot of things. So, is there any times where you will just be sitting down or you're doing something and your lungs starts to feel any pain in your lungs or in here in your chest area? Do you feel any of those?
No.
No. Okay. So, in everything overall, you don't feel any pain in your neck, no? Or is there any stiffness? Yung parang, whenever you try to do something for very long, then you start to feel that your neck is ouchy.
No.
No? Okay, that's good. So, Okay, so now what we're going to be doing is we're going to be palpating the posterior chest. So in here, what we're going to be doing first is to ask the client if they have a difficulty in breathing. Do you have any difficulty in breathing? Like, is it ouchy to breathe, or do you have any shortness of breath?
No.
No. How about in the past week? Do you feel any breathing problems like that?
No.
No. Okay, so that is good. So now, since there is no concerns or no complaints of the respiratory any respiratory problem, we're gonna be palpating for the respiratory extrusion. So in here, what we're gonna be doing is have the patient turn backwards in here. Yeah, that's very good. So now, what we're gonna be doing is we're gonna be placing our hands in here in the lower what do you call this? Lower thorax in here, with the thumb in the adjacent side and the fingers in the lateral. So now we're going to be asking the patient to breathe in and out, and we're going to be observing for the movement or if there's any lag in the movement. Okay, ma'am, can you please breathe in, deep breath? Okay, follow me, ma'am. Okay, again. We're going to be doing it. Okay, breathe in. Okay, breathe out. Okay, another one po. Breathe in, breathe out. Okay, so as we can see, as the patient have inhaled and exhaled, our hands came up with it. So, para pag-inhale niya, it went up. Pag-exhale niya, it went down. So, as we all have observed the movement, that is a good sign na her respiratory organs are really working. Okay, so now what we're going to be doing is we're going to be palpating the chest for vocal tactile fremitus. So in here, what we're going to be doing is, again, we're going to be placing in here the posterior for the posterior chest. So in here, so starting in the apex of the lung, so in here, so it's really above in here like that. Okay, so this is, since this is the base, this is the apex of the lungs. So as he or she breathes, like in our case, as she breathes, we must feel the movement in there. So we're gonna be placing it like how we did in the one kanina. So in here, we're going to be asking the patient to repeat words kasi we're going to be sensing for vibration. So as the patient talks, we're going to be feeling vibration in here, okay? So in here, we're going to be checking in here. So ma'am, as I put my hands in here, I want you to say the words 1, 2, 3, okay? Okay. Say it 1, 2, 3.
1, 2, 3.
Again pa.
1, 2, 3.
Okay, so I have felt the vibration, so that is good. So now we're gonna be doing it in the base of the lung, so in here. Okay, I want you to say the same phrase po kanina 2 times po. Again.
1, 2, 3. 1, 2, 3.
Okay, so now what we're gonna be doing, as we have did it one by one, what we're gonna be doing is we're gonna be comparing it. Okay, so in here, we're gonna put one hand in here in the apex of the lungs and one hand in here in the lower. Okay, so I want you to say the same phrase po, ma'am. Okay, 1, 2, 3.
1, 2, 3.
Okay, isa pa po.
1, 2, 3.
Okay, so from what I can feel, it is more nag-vibrate siya dito sa apex naman, and rather than in here sa base. Maybe because mas lower ang nandito, nasa base talaga siya ng lungs. So now once we have that, so we're good. So as we compare, we can see the difference of how the is or the vibration is felt. Okay, so yun po siya. So now we're gonna proceed in the next assessment. Now we have a little bit of history. We're gonna proceed to the assessment, okay? Okay, so first I'm gonna be inspecting your neck muscles in here, okay? So we're gonna be looking for the abnormal swelling, if there is any parts where para it's getting bigger or it's red like that, okay? So, or if there is any masses. So can I ask you to lift your chin lang, erect your head, okay? So in here we don't see any swelling. It's all right. So there is no masses that can be seen in the patient's or the client's neck. So there is no any redness that we can see naman. So I think it's all alright. So you can turn your head back. Okay, so in here, we are actually checking for the neck muscles in here. So it is a little bit visible din naman. So these neck muscles are actually skeletal muscles. They are connected to the bones by the tendons in there. And we have actually more than 20 neck muscles. So extending from the base of your skull and jaw to the shoulder blades in here, shoulder blades and the collarbone in here, or the clavicle. So for this one, these muscles actually support and stabilize your head and neck. So if there are times where it's feeling pain, diba? Sometimes your head also feels it's hard to carry your head, right? Because that's the one that's supporting your head. So your upper, then the upper of your spine there at the back. So they help you move your head from different angles. Like for example, whenever you look in your left or your right, diba? Sometimes you would feel pain. Maybe you stared at something for very long. Then when you move your head, it feels a little bit painful, right?
Yeah.
Yes, okay. So that is normal because there are really times where our neck muscles maybe feel overworked like that, okay? So for your neck muscles also, they also help you assist swallowing, chewing, diba? So minsan, if your neck hurts, you have a trouble or you have a hard time chewing, diba? Sometimes you don't even have the appetite to eat, diba? Kasi it actually affects your chewing, your swallowing of the food. And also, of course, your breathing. Kasi dyan man the air will pass through your nasal naman and nasal cavity down to your lungs, di ba? Okay, so this is why it's important to assess the neck muscles. So we're good with that. Now we're gonna be observing the movement. Okay, so I'm gonna be asking you to move your head from sideways or look down or look up so we can assess some of the important neck muscles. Okay, so can you move your chin down to your chest? Like look down like that. Okay. So do you have any hard time doing that?
No.
Or is it ouchy here in the back? No.
No.
No. Okay. Look up again. So that will actually determine your ano yan? Sternocleidomastoid muscle. So if you can do that without any feeling any pain, so that muscle is actually okay. Okay, so you're not feeling any pain. So now can you move your head back like that? Move your head back. Okay. So this will determine the function of your trapezoidus muscle. Okay. So you can put it back down. You don't feel any pain, no?
No.
Okay. So can you move your head like in the side so that your head is touching, your shoulder is touching your ear? Okay, so the other side. Okay, so you don't feel any pain, no? There's no stiffness of the neck, no? Okay, so that means that her sternocleidomastoid muscle is just functioning well, so there's no pain that the client can feel. Then, can you turn your head from left to right like that, left to right? Okay, so that's good. So she doesn't feel any pain, no?
Yeah.
Okay, so your neck doesn't show any, there's no swelling, so that is good. There's no any lumps or bumps that is visible. Also, you can turn your head or you can move your head to directions and it is also functioning well. So now we're going to be assessing the strength of your muscle. So I want you to shrug your, wait lang. I want you to put your parang um oh my god. I will just cut it. Okay, so now we're gonna be assessing the strength of your neck muscles, okay? So I want you to turn your head against my resistance, okay? So when you turn, what side is this? But when you turn left, my hand will try to resist it, okay? But you still have to turn left, okay? Go. Okay. So the other side. Okay. So now we're gonna try to your shoulders. You shrug your shoulders, okay? So I'm gonna put it here. So you try to lift it up, okay? 1, 2, 3, go. Okay. So that is good. So that is your neck muscles. You have assessed your neck muscles. So overall, from what I can see, there's no inflammations or there's no abnormalities naman. It's all parang aligned. Your head is not parang positioned a little bit to the side, so it's just in the middle. Also, your neck muscles is okay. So there's no pain when I instructed you to move your head to sideways, right?
Yes.
Okay, so that is good. So we're gonna be proceeding to the lymph node, okay? So now we're gonna be assessing the lymph node. So in here, we're trying to look for any enlargements of the lymph node. We want to see if there's any lumps or if there's anything hard or anything that may be inflamed in the lymph node. So we're gonna be doing this by doing the circular motions on the lymph node locations in the head and in the neck. So in here, so first we're gonna start with the pre-auricular in here. Do you feel any tenderness, pain?
No.
No. Okay. The posterior auricular in here. Do you feel any no?
No.
No. Okay. This is the parotid. Do you feel any no?
No.
Okay. In your tonsillar in here. Do you feel any tenderness?
No.
No. In your submandibular in here.
No.
In your submental in here.
No.
Okay, so now in your superficial cervical in here, it's just in here. Do you feel any pain?
No.
No. In your posterior cervical in here, do you feel any pain?
No.
Okay, this is down here is your deep cervical. Okay, do you feel any pain?
No.
Okay, now for your superficial clavicular in here, do you feel pain?
No.
Okay, and now finally your occipital. In here, do you feel any pain?
No.
No, okay. So that is good. So now the patient doesn't feel any pain and we're going to be taking note of that. So now we're going to be assessing the trachea of the client. So we are going to be palpating the trachea for lateral deviation. So palpating the lateral borders of the trachea via the sternal notch helps in determining the trachea is in the normal and in the middle position or not. And as a deviated trachea can indicate lung pathology. So in here, what we're going to be doing is we're going to be using our fingers. So in here, this is the sternal notch in here. So we're just going to be placing our fingers on the lateral sides of it. Okay, so here, then we're going to start feeling. Okay, so now we're gonna feel so in here I can see that it's just in the middle. So we can, in this way, we can also test the tracheal tug. So we can ask the patient to breathe in. Okay, ma'am, can you breathe in pa? Okay, breathe out. Okay, so that is how we assess the trachea. So now we're going to be assessing the thyroid gland. So in here, we're going to be inspecting it first. So in here, you can see there's no, can I end this a little? Okay, so there's no abnormalities in there naman. Okay, can you put it on? Okay, thank you. So to inspect this, we're also going to be observing the lower half of the neck. So in here, overlaying the thyroid gland for the symmetry and visible masses. So in here, we can't see any swelling naman in the other side, or we don't see any abnormalities. It's just in a perfect condition. There's no redness or there's no lumps or masses that is visible in the thyroid gland area that can be seen. So now we're going to be asking the patient to hyperextend her head and to swallow. So for this, we're going to be asking the patient to drink a little water. Okay, don't swallow it yet, ha? Okay, sige. May I a little, then swallow po. Okay, so you can see that it moved din naman. So is there any pain that you felt while swallowing it? No naman, no?
No.
Okay, so that is good. So we're going to be taking note of that. So now we're going to be palpating the thyroid gland for smoothness. So we shouldn't feel any lumps or bumps in here for normal findings, and the patient should not feel any tenderness. Okay, So can you lift your head above and then you touch on your neck, okay?
Okay.
Okay. So tell me if there's any tenderness as I palpate your thyroid gland. Do you feel any pain?
None.
None? Okay. So we felt naman that it is smooth and there's no any hardness that can be felt, or there's no bumps or lumps that can be felt over the thyroid gland. Okay, so now we're going to be taking note. If we do see some, we're going to be taking note of the enlargement, the masses, and the nodules. And if it is suspected that there is an enlargement in the thyroid gland, we auscultate over the thyroid for Broods. So since there is none, and the client rather, is in a perfect condition, that will be all for the thyroid gland assessment. So now we're going to be assessing the thorax and the lungs. So we're going to start with the posterior thorax. So for this one, ma'am, we have to stand up muna, ha?
Okay.
Let me get this chair. Okay, so for this one, we're going to be checking for the shape and symmetry of the thorax from the posterior and lateral view. So we're going to have the patient turn back first. Okay, so this is the posterior thorax. Okay, so now we're going to be inspecting for the spinal alignment in here. So we don't see any deformities naman na parang the patient's, can we move a little? The patient's back is like sliding to the left and right. No, we don't see any. So it's just in a perfect line. So it has right alignment. Can we move a little here? Okay. So in here, we're going to be asking the patient to stand up. She's already standing up. And we're going to be checking for the lateral position and observe the three normal curvatures. So first is the, ma'am, I'm going to put it up a little, the cervical in here. So next we're going to be the thoracic in here. Now the lumbar in here. So we see naman fine in here. So for the lateral view in here. So in here we see that there's nice curve naman in here, a little, it's nice then. Tapos in the lumbar. So it's like that. Ganun siya. So which is perfect. Perfect lang to siya. So now we're going to be observing the standing or the posture of the client. So from the rear, so we need to ask the patient to bend forward. Okay. So we're going to be looking from the behind. So this is to test if the patient has a scoliosis or the deviation, lateral deviation of the spine. So can you please bend forward pa, like until your waist. Sige daw. Sige. Okay, we don't see naman any. Okay, you can go back naman. Okay, so as you can see, that she doesn't have any scoliosis because there's no deformation rin naman, and she did not have. And do you feel any pain when you were bending down?
No.
No. Okay, so that is good. So that is how we inspect the posterior thorax of the patient. Now we're going to be percussing the patient's thorax. So we're going to be percussing for the diaphragmatic excrusion. So we actually have a pattern that we can follow when we are percussing the anterior thorax or anterior chest of the patient. So now to do this, we're going to be having the patient to remove her clothes. And here, she actually removed it and the front can't be seen, pero it can't be seen in here, but it's open in here. So we're going to be starting in here, in the right area rather of the patient. So put your hands in here and make sure in percussing that your wrists are loose, so you can create a better sound rather. So we're going to start. Okay, so as you can hear in here, the left side of the patient is more, it sounds louder. So in here, just above the chest. Okay, now in here, can you lean back a little? Right now. You can adjust your seat, move back. Okay, so now we have that. Now we're gonna be percussing the posterior part of the chest of the patient. So can you stand up first? Okay, so I will be changing first. I want you to, in here. In here. So, ito lang makita. Okay. Now, in here, so you can see in here, the chest. So we're gonna be starting in here. In here. Okay. The same, it is a zigzag pattern. Okay. Then in here. Okay. Then in here. Okay. Then in here. In here. Okay. And down here. Okay. Here. Okay. Then here, the lower part. Okay. Okay, so in here, we can hear sounds, and here, the lower part na talaga, it's a bit harder to hear a sound or a resonance of the sound. Okay, so now what we're gonna be doing is, after percussing, we're gonna be getting our stethoscope and auscultating the chest using the diaphragm of the stethoscope. So we're gonna have the patient turn there first. So since the patient is already facing back there, we're gonna be auscultating the posterior view of the chest first. So while we do this, we're gonna be asking the client to breathe in and out. Okay, while we are auscultating. So the same patterns lang for the zigzag pattern. Okay, ma'am, I want you to take a deep breath once I say okay, okay?
Okay.
Okay, let's start in here. Breathe in. Breathe out. Okay. Again, breathe in. Breathe out. Okay. Breathe out. Breathe in. 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 Breathe out. Last, breathe in. Breathe out. Okay. So now, we're going to be doing it in the anterior side. In here. Okay, so sit down. Okay, so the anterior side of the client. So in here we have is, okay, so I need you to breathe in and out, okay? Okay, breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Okay, I'm gonna be putting it inside ha para ano. Okay, breathe in, breathe out. Okay, breathe in, breathe out. Okay. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Okay. So once we have once we heard everything so now we're gonna be comparing the posterior and anterior, our findings in the anterior and posterior thorax. Now we're gonna be inspecting the anterior chest. As I did kanina, it was also already palpated in here from the clavicle to the diaphragm. So we're already done with that. We have also compared their sounds already and their auscultation in both of the posterior and the anterior side. So now what we're gonna be doing for the anterior thorax. So we're gonna be doing we're gonna be inspecting the costal angles in here. So the costal angles is the one in here, just below or just above the rib cage in here. So what we're gonna be doing is inspecting that first, and the angle which the rib cage is parang gonna be connected to the spine. So in here at the back side. So now we can see that there's no deformities naman that the other side is bigger or the other side is smaller like that. So there's no, can you stand up? So you can have a good look in here. So we don't see any here. Now what we're gonna be doing is we're gonna be palpating it, okay? For the okay. So in here I'm gonna put my hands in here the way we did earlier for the posterior, then just above the radiation here. So I'm gonna ask you to breathe in and out, okay? So breathe in, breathe out. Okay, again. 1, 2, 3. Breathe in. Okay, breathe out. Okay, again, minimize it down again. Okay, so now we have that one. What we're gonna be doing next is to palpate the tactile primitus in the anterior thorax, just like what we did in the posterior. So, okay, breathe in, breathe out. Okay, so that is good. So now what we're going to be doing is going to be comparing it now to what we found in the posterior part of the thorax. So now we have all of our findings. What we're going to be doing is documenting them. Okay. So once it is documented, that is the end of the neck, thorax, and the lung assessment.